Did you know that your skin can be affected by some of the most terrifying diseases? It's true, your skin isn't just your body's largest organ. It's also a battlefield where some truly horrifying conditions wage war. These diseases can have serious impacts, not only on your skin, but also on your overall health and well-being. Today we're going to explore this often overlooked aspect of health. So prepare yourself, we're about to embark on a journey to uncover the 10 most terrifying skin diseases. Brace yourselves as we delve into the 10 most terrifying skin diseases. Starting off our countdown at number 10, we have psoriasis. Psoriasis is a chronic skin condition characterized by red, scaly patches of skin that can be itchy and painful. It's believed to be an autoimmune disease where the body's immune system mistakenly attacks healthy skin cells, causing an accelerated cycle of skin cell turnover. The symptoms can range from mild to severe, with some individuals experiencing patches of dry, cracked skin that can bleed, while others may have swollen and stiff joints. The exact cause of psoriasis remains unknown, but a combination of genetic and environmental factors appear to play a role. Although there is no cure, treatment options can help manage the symptoms and improve quality of life. These may include topical treatments, light therapy, or medications. Psoriasis is not just a cosmetic concern, it can significantly affect a person's daily life and self-esteem. While not life-threatening, psoriasis can certainly be life-altering. Moving on to number 9, we encounter vitiligo. This is a long-term skin condition where patches of skin lose their pigment. The cells that make pigment in the skin, called melanocytes, are destroyed, leading to irregular white patches. It's not exactly clear why this happens, but it's thought to be an autoimmune condition, where the body's immune system attacks and destroys these melanocytes. Symptoms of vitiligo are quite straightforward. White patches appear on the skin, usually in areas exposed to the sun. It affects all races and both sexes equally. And while it's not life-threatening or contagious, its impact on a person's appearance can cause psychological distress and may lead to low self-esteem. Treatment options for vitiligo vary, ranging from topical creams and light therapy to even tattooing. The goal is to restore the color to the white patches of skin. Vitiligo might not endanger your life, but it could potentially harm your self-confidence. At number 8, we have rosacea. This skin condition is a chronic disorder primarily affecting the facial skin, often characterized by flare-ups and remissions. It typically begins after the age of 30 as a redness on the cheeks, nose, chin, or forehead that may come and go. Over time, the redness tends to become ruddier and more persistent, and visible blood vessels may appear. While the exact cause of rosacea is unknown, it can be triggered by factors such as extreme temperatures, spicy foods, alcohol, and stress. Symptoms can vary, but often include facial redness, swollen red bumps, and eye problems. The good news? It's not as terrifying as it sounds. While there's no cure for rosacea, treatments can control and reduce the signs and symptoms. From topical drugs that reduce redness to oral antibiotics to fight inflammation, there are various ways to manage this condition. Rosacea can make you want to hide your face, but remember, it's manageable with the right treatment. Coming in at number 7, we have shingles. Shingles, also known as herpes zoster, is an infection caused by the varicella zoster virus, the same virus that causes chickenpox. Once you've had chickenpox, the virus lies inactive in nerve tissue near your spinal cord and brain. Years later, it may reactivate as shingles. Shingles characteristically causes a painful, blistering rash, often wrapping around the torso like a stripe. Other symptoms may include fever, headache, and fatigue. The most feared complication of shingles is post-herpetic neuralgia, a condition where the pain from shingles continues long after the rash has disappeared. Fortunately, antiviral drugs can speed up the healing process and reduce the risk of complications. Vaccines are also available to help prevent shingles or lessen its severity. Remember, early treatment is key to managing this condition. Shingles is painful, but with early treatment, you can lessen its impact. At number 6, we find cellulitis. This menacing skin infection is caused by bacteria, often Staphylococcus and Streptococcus, which penetrate the skin through a cut or crack, causing redness, swelling, and pain. But it doesn't stop there. If left untreated, cellulitis can spread rapidly, infecting the lymph nodes and bloodstream, making it potentially life-threatening. The symptoms are hard to ignore. When the skin turns red, becomes tender and swollen, and you feel warmth in the affected area, you might be dealing with cellulitis. Other symptoms can include fever and chills, red spots or blisters, and skin dimpling. Don't take any chances if you suspect you have cellulitis. Seek medical attention immediately. Treatment typically involves antibiotics to fight the infection, and in severe cases, may require hospitalization. Remember, the quicker you get treated, the better your chances of a full recovery. Cellulitis is a serious condition that requires immediate medical attention. Halfway through our countdown at number 5, we have necrotizing fasciitis. This disease, also known as flesh-eating bacteria, is as terrifying as it sounds. It's an infection that results in the death of parts of the body's soft tissue. It's incredibly aggressive, spreading rapidly across the body. Necrotizing fasciitis is caused by several types of bacteria, some of which are commonly found on the skin and inside the body. If these bacteria enter the body through a break in the skin, they can lead to this life-threatening condition. Symptoms can start with pain and redness at the infection site and escalate to fever, dizziness, and fatigue. Treatment involves aggressive antibiotics and often surgery to remove dead tissue. In severe cases, amputation of the affected limb may be necessary. The speed and severity of necrotizing fasciitis make it a truly terrifying disease. But remember, it's extremely rare. It's estimated to affect less than 1 in a million people each year. Moving into the top 4, we encounter melanoma. Melanoma is the most dangerous type of skin cancer and is primarily caused by intense, occasional UV exposure, particularly for those who are genetically predisposed. It often appears as a dark spot or an existing mole that changes in color, size, or shape. Now, what makes melanoma truly terrifying is its ability to spread rapidly, moving from the skin to other parts of the body such as the lymph nodes and organs. When it reaches this stage, it becomes highly difficult to treat and can often be fatal. However, it's not all doom and gloom. Melanoma is highly treatable when detected early. Treatment options range from surgical removal of the melanoma and surrounding tissue to targeted therapies and immunotherapies for advanced stages. So, remember to take care of your skin and seek medical advice if you notice any changes. Melanoma is deadly, but with early detection, it's highly treatable. Making our way to number 3, we find Stevens-Johnson syndrome. This is a rare, severe disorder of the skin and mucous membranes, often in response to medication or an infection. It begins with flu-like symptoms, followed by a painful red or purplish rash that spreads and blisters, leading to the top layer of the skin dying, shedding, and then healing. Triggers can include anti-epileptic drugs, antibiotics, and even over-the-counter pain relievers. The syndrome can affect any age group, but it's more common in people with a family history of the disease. The first line of treatment is typically stopping the medication that caused the condition, followed by supportive care to help relieve symptoms and prevent infection. In some cases, treatment may also involve intravenous immunoglobulins, corticosteroids, or other medications to reduce inflammation. Stevens-Johnson syndrome is a serious condition that requires immediate medical attention. At number 2, we find Epidermolysis bullosa. This is a group of rare diseases that cause the skin to become incredibly fragile. The slightest friction or even temperature changes can lead to painful blistering. At its core, epidermolysis bullosa is a genetic condition that affects the body's ability to produce certain proteins that lend strength and flexibility to the skin. The symptoms range from mild blistering of the hands and feet to severe cases where large portions of the body are affected. The blisters may also affect internal organs and body systems, leading to potentially life-threatening complications. There's currently no cure for epidermolysis bullosa. Treatment focuses on managing symptoms to prevent pain, infection, and other complications. This could involve wound care, pain management, nutritional support, and in some cases, surgical intervention. Epidermolysis bullosa is a devastating condition, but ongoing research offers hope for better treatments. The future is looking brighter as scientists continue to explore the genetic origins of the disease and develop new therapies. And finally, the most terrifying skin disease at number 1, Harlequin ichthyosis. This is a severe genetic disorder that primarily affects the skin. Infants with Harlequin ichthyosis are born with very hard, thick skin covering most of their bodies. The skin forms large, diamond-shaped plates that are separated by deep cracks. These abnormalities affect the shape of the eyelids, nose, mouth, and ears, and limit movement of the arms and legs. The cause of this condition is a mutation in the ABCA12 gene. This gene provides instructions for making a protein that is necessary for the normal development of skin cells. Treatment is mostly supportive, focusing on keeping the skin moisturized and preventing infection. Due to advancements in neonatal care, children with Harlequin ichthyosis can now survive past infancy, but they require intensive care at birth and ongoing therapies throughout their lives. Harlequin ichthyosis is the most terrifying of all, but remember, it's extremely rare. There you have it, the 10 most terrifying skin diseases. From the persistent discomfort of psoriasis, the pigment loss of vitiligo, the facial redness of rosacea, the painful rash of shingles, the potential severity of cellulitis, the life-threatening necrotizing fasciitis, the deadly melanoma, the blistering Stevens-Johnson syndrome, the harrowing epidermolysis bullosa, to the extremely rare Harlequin ichthyosis. Each disease underscores the importance of skin health. Seek immediate medical advice if you have any concerns. Remember, your skin is your body's largest organ. Take good care of it, and it will take care of you.